Hey folks, my name is Mo Amir and this is VANCOLOUR, British Columbia's bona fide culture and politics TV talk show. Tonight we're continuing a tradition of sorts here on this program, chatting with a certain someone towards the end of each season. A man of his word, even as he's about to welcome a new addition to his family. He's here for the entire show to talk about healthcare, property transfer tax evasion, money laundering, and politics as we look ahead to October's provincial election. Since 2013, he's been the BC NDP MLA for Vancouver Point Grey. He is, of course, the Premier of British Columbia, David Eby. Premier Eby, what an honor as always. Thanks for being here tonight.
Thanks for having me back, Mo. It's good to be here.
So you've met my dad, Mo Senior.
I have.
His biggest election issue right now is healthcare. He is a senior. He probably doesn't like me saying that. He's in good health, but he looks at the state of hospitals that are overburdened. He looks at long wait lists to see specialists and to get specialized tests. And he sees the shortage of healthcare workers, particularly family doctors. And he's very worried that healthcare is not only crumbling, but it's going to get worse. What would you say to him and British Columbians like him with those concerns?
Well, I think it's a common experience of British Columbians, and their concern really is pre-pandemic and post-pandemic. The pandemic was hugely stressful on healthcare workers and had a huge impact on our healthcare system. And a lot of folks in our healthcare system that were close to retirement said, you know what, I'm done. I'm ducking out. And it wasn't just us. It was right across Canada. And as a result, we've got an aging population and a group of healthcare professionals that's smaller than it was. And so the obvious and the major piece around healthcare was to get as many healthcare workers back into the hospitals, back into community as we could, as quickly as possible. So that meant recognizing internationally trained doctors and nurses and other healthcare professionals so they get off the sidelines and start providing care in our communities, making sure that they were working in world-class facilities, opening new hospitals across the province, investment in the physical infrastructure of healthcare, and putting in place a plan to train and hire up the healthcare professionals we need, recruiting healthcare professionals from the UK, opening the first new medical school in a generation in British Columbia. So the good news for your dad is it's working.
Okay.
We've added 700 new family doctors. We've reduced that wait list for family doctors by about 300,000 people. We've got a new province-wide system to attach people to family doctors. 6,000 new nurses across the system. We're leading Canada in adding new nurses to the system. And there's more to do. There's still a lot of strain in our healthcare system, but the big piece is getting those healthcare professionals in place, and we're turning the corner. We got to keep pushing, though, to make sure that this is reality. And unfortunately, there are proposals to reduce budgets for healthcare, which will lead inevitably to reduced services like home care for seniors like your dad.
Let's talk about bringing those healthcare workers back, because your political opponents, BC United and the BC Conservatives, I believe rightly point out that British Columbia is the only jurisdiction in North America that hasn't hired back healthcare workers, particularly nurses who were let go or lost their job because they refused to comply with the COVID-19 vaccine mandate. Why is BC going alone on this?
That's an important distinction between the parties. You know, at a moment when there is vaccine hesitancy in the public, people are like, they've heard a lot about vaccines. Maybe I shouldn't get vaccinated, all these kinds of things. Both John Rustad and Kevin Falcon have been advancing, frankly, what I see as anti-vax views at a time when we've got a measles outbreak in parts of Canada, and Quebec in particular. And so this is kind of an unheard of thing. This is a disease that should be eradicated by vaccines. So we're continuing to follow the science on this. We continue to have advice that it's safer for seniors, it's safer for people in long-term care if the staff are vaccinated against COVID. We shouldn't go backwards on requiring vaccines for healthcare workers. It's not compromising our ability to recruit healthcare workers.
Okay.
We're leading Canada in recruiting nurses and doctors and other healthcare workers. Alberta, which is taking a different position on vaccines, I'll say generously, they are struggling to hire healthcare workers in a way that we're not. And I think it matters to healthcare workers that they know that the colleagues they're working with are supportive of things like vaccines or getting vaccinated. It's safe for patients, and patient care is number one. That's a different opinion from John Rustad and Kevin Falcon. John Rustad was the one MLA who supported the anti-vax trucker convoy protests in Ottawa. He has some pretty far out views on this stuff. and it's profoundly anti-science. And so we're saying to people, look, we're just going to follow the science on this stuff, and we're going to support them with the healthcare team that is in the best shape possible to be able to provide the care they need.
So what is one of those healthcare workers who was let go because they refused to comply with the mandate? What do they have to do to get back into working?
Just need to get vaccinated. It's very straightforward.
That's it. Okay. Yeah. Now, 2 weeks ago, BC Conservative leader John Rustad, who you just referenced, talked about looking at different healthcare delivery models that he sees around the world, particularly in Europe. Now, he's not talking about American privatized insurance. He's talking about systems that are universal, that are single payer. And he's saying that we should explore those models, even though they do incorporate a sense of or more privatization in the system. Is that something you'd be willing to look at in terms of reforming our system or just making it better for British Columbians?
Well, yeah, I think, for most British Columbians, they look at the healthcare system and they're like, don't be ideological about it. Just what's going to provide me with the best care possible? And when we look at the healthcare system, the big challenge we face is a shortage of healthcare professionals in key areas to be able to deliver the kind of care we need, especially in rural and remote communities, other places. So it does puzzle me when the suggestion is, well, if we opened up to more privatization, we'd be able to deliver more care, because what happens is the public system will be competing for the same healthcare professionals with the private system. The private system will inevitably offer more money. We'll lose more health professionals from the public system, making it more challenged. We'll have to turn more and more to the private system and have to pay them not just the cost of delivering the care, but also a profit margin as well, because that's the definition of private health care.
Sure. Yeah.
And so how does that actually advance us in this discussion? I can see how it might help with, the private company is taking on the capital cost of the MRI machine or something like that, but you still need somebody to run it. And that's where we're really running into the problems in the healthcare system. So, we're open to any kind of possible solutions, but explain to me how fighting with a giant North American healthcare company that has obligations to its shareholders for the same health professionals, how is that going to advance the healthcare system? I just don't see it.
But year on year, doesn't the BC Ministry of Health actually increase its expenditure to private surgical centers? And we know that we're sending cancer patients to Bellingham to get privatized care at the taxpayer expense. Like, it sounds like we're already softly and slowly doing that, aren't we?
Well, this is what I mean, Mo. So, we're trying hard not to let that ideology influence decisions. So if people need cancer care, and we can access cancer care for people urgently by going to Washington State, where they have the clinic, they have the staff, and we get people the care they need in the timelines that we know they have to get in order to be able to have the best chance of fighting cancer, we're going to do it. And that is not going to come at the expense of our British Columbia healthcare system, because we're using those resources in Washington State. And so it's an example of how do we get the problem solved? How do we support people? But it's also short term. We've got the cancer strategy in place with BC Cancer to make sure that we're opening cancer centers across the province, training up the cancer docs and the technicians to give the chemotherapy and the support that people need. And when we're not able to meet those minimum benchmarks that we know we have to meet, we're willing to look at other ways to get it done.
So you're saying those are short-term solutions, but long-term you want it to be all public.
Exactly right.
Okay. Now, decriminalization, the pilot project started under your premiership. I know there were some rollbacks to that program. I guess my question is, what have you done since you've become premier to stop the deaths from the toxic drug supply crisis? And it is still a public health emergency.
Yeah, it is. So it's been a long and winding road over just the 2 years I've been premier. The work started in 2017, obviously responding to the toxic drug crisis. I'm going to take you back then. We've got one overdose prevention site in the entire province. We've got a system of treatment for people struggling with addiction that relies on private clinics that charge various rates, and some that are totally unregulated, delivering care in communities at very low standards, and it we could see the deaths climbing up in British Columbia. The pandemic supercharged us. We saw the drugs get more toxic, synthetic opioids showing up in large numbers, carfentanil and fentanyl. And we're in a whole new world now. So currently in the province, we've got more than 50 overdose prevention sites. Half of those approximately have inhalation, and there's more work happening. But since I was sworn in, the focus for me has really been about how do we ensure that seamless care when someone has that moment of saying, look, I want treatment. So we've opened the Road to Recovery project at St. Paul's Hospital. People show up with an overdose. They go right into detox, right into treatment, right at the hospital, and then into a recovery community. That seamless approach, it's already helped hundreds of people out of St. Paul's Hospital. For people really struggling with mental health, addiction, and on occasion brain injury. Partnership with Julio Montana's Hope to Health Clinic in the downtown east side, starting there but expanding across the province to provide wraparound care so that people don't have to show up in emergency rooms. We had one guy show up in emergency rooms 180 times last year.
Wow.
And a group of 5 people show up more than 140 times in emergency rooms to provide support and care for people like that, to take pressure off the emergency rooms. And there's a group of people, Mo, that are really struggling. They have that trifecta of addiction, brain injury, and they're addicted to synthetic opioids. They're not attending clinics. They're not even necessarily going to the emergency room voluntarily. And we're just not clear about what our best approach is to treat them. So I've asked Dr. Vigo, who's an expert in psychiatry and addiction, to look at international models, other ways that we can support this group. This is the group that people think about when they think about the toxic drug crisis, the people on the street corner, struggling in the streets. And what we've learned is that there's distinct groups. There's people who work in construction that have injuries using opioids to cope with pain. They're using alone, their family doesn't know. That was what decrim was really aimed at. And this group that's in the street really struggling in a very public and visible way. We're still trying to find the best way to treat this group. So are other provinces across Canada and other states.
Sorry to interrupt really quickly. We have about 40 seconds left here. I know.
Sorry, Mo.
Why is it that when it comes to the COVID-19 pandemic, Dr. Bonnie Henry's word is basically gospel and we completely follow it. But then when she advocates for the expansion of safe supply, your government is very quick to say, no, we're not going to do that.
Well, the short answer is I don't understand how stimulant safe supply would ever work. Working with people who use stimulants, they will use stimulants until the stimulants are done. Crystal meth, crack cocaine, other drugs. I cannot fathom how distributing government crack or government crystal meth is going to support people struggling in that way. And that's why we're building out the treatment models we are.
We do have to take a commercial break, but once we're back, let's talk about white collar crime.
Okay, sounds good.
Welcome back to This is VANCOLOUR. We're back with BC Premier David Eby. He's cooling the hot seat for the entire show tonight. And speaking of cool, this conversation is brought to you by Pacific Sands Beach Resort in Tofino, laid back luxury, as beachfront as it gets. So Premier Eby, from my understanding, if there's a private company that owns a bunch of real estate holdings, whether they're homes or offices or industrial land, whatever it is, and that company is sold to a new buyer, that new buyer doesn't actually have to pay the property transfer tax that, say, you and I would have to pay if we purchase a home. This is known as the Bear Trust loophole. Is that correct?
That's right.
So why hasn't your government closed this loophole? Because in 2016, John Horgan, who was the leader of the official opposition at the time, actually introduced a private member's bill to close this loophole. You and I have talked about this for years. It's still open. These people and these companies are not paying property transfer tax.
Yeah. So I'm going to take you back to the money laundering inquiry. And one of the key recommendations, one of the key initiatives that we took out of that was that we didn't actually know who owned property in British Columbia.
Right.
Makes it very difficult to know when ownership shifts hands, especially in Bear Trusts, when you don't have to register it with anyone. The name on the deed stays exactly the same. And there's no way for government to know that the property has actually shifted beneficial ownership. So what we did was we implemented a whole new registry in the province, the Beneficial Ownership Registry, so that people have to declare who actually owns the property. And some of the conversations would have made you laugh because there were a whole bunch of lawyers who were saying, we're having a really hard time figuring out who actually the beneficial owner of properties in British Columbia are. We need an extension. So we actually gave people an extra year to be able to register who the beneficial owner of the properties was. That wrapped up in November of 22. So we've had for just over a year the beneficial ownership registry.
Okay.
This gives us the tools we need to be able to close this loophole and address the transfer of properties, attempting to circumvent the property transfer tax that you and I would both have to pay if we were buying or selling property in the province.
So why can't you dust off that old private member's bill and pass that through? Like you've had a lot of time to do so.
Yeah, it was written in the time before we had the beneficial ownership registry, when we were able to have that tool to actually actually know that, who owns the properties and who's transferring the properties. So now that we've gotten to implementation on that, it gives us the tools to be able to take that next step, Mo. We didn't have the tools to be able to enforce it.
I'm going to take that as a campaign promise.
Okay. Yeah, election's coming, man.
Now, is money laundering solved in British Columbia? Because you used to talk about that a lot, and now we don't seem to talk about it as much. And I know that there are key recommendations from the Cullen Commission report that have yet to be enacted. The anti-money laundering czar that was supposed to happen, the investigative unit that was supposed to happen. The province hasn't moved on this. So what's going on?
Okay. Well, I would say there's some things that we've shown really good progress on, and there are things that definitely need some more work. So the things that I'm really happy about, we won a really important case seizing the Hells Angels clubhouses. We've launched our unexplained wealth orders, where people have a whole bunch of money. They're buying real estate. We don't know where it came from. They have to prove in court where it came from, in particular going after people who have benefited from securities fraud. So we're getting away from that province where someone commits a massive fraud, buys a bunch of property, and then there appear to be no consequences in the province.
Okay.
We've had some good success on that. Where we're still struggling is around that sort of transnational organized crime bit. So we have Paul Gin, who is sort of a kingpin in the anti-money laundering public inquiry. He's currently going through a civil forfeiture process with the province. It's in front of the courts right now. It's going to be a very important precedent for us. We're struggling to get the information from the federal government, particularly from CSIS, around what's happening in British Columbia so we can take further steps. They just passed a new law federally so we can get that information. The federal government's committed to this enforcement body around financial crime. There's money in the budget around implementation. We're working with them on that. So these pieces are moving along. It's never as fast as I want it to be, especially when the courts are involved.
Yeah.
But we are moving in the right direction, and we are seizing those properties, and those people are in court, and hopefully we're able to get across the finish line with those.
Okay. Well, we have to take one more commercial break. Once we're back, let's talk about your friend, John Rustad.
Okay.
Folks, don't go away. Premier David Eby is chomping at the bit for more questions. Thank you so much to Pacific Sands Beach Resort in Tofino for supporting local conversations with local leaders. Now, after some business, Premier Eby called the surging BC Conservatives a threat to our functional democracy. He'll explain those comments up next. Welcome back to This is VANCOLOUR. Ahead of October's provincial election, we're here with the leader of the BC NDP and the Premier of British Columbia, David Eby. Premier Eby, you didn't run away. So thanks so much for sticking around.
Absolutely, Mo. I'm glad to be here.
Let's talk about some comments you made back in October. You basically characterized the BC Conservatives and their leader, John Rustad, as a threat to our functional democracy. That's a quote. They don't seem to be doing anything illegal as far as I know. So what does that mean?
Yeah, I think, Mo, there's two pieces that I see when it comes to what John Rustad's talking about for our province. One is, I mean, we've got a precious thing here in British Columbia. We got a place where people of all different backgrounds, faiths, beliefs, understandings get together, and we work together to build an amazing province. Indigenous people, LGBTQ, people from around the world, they leave their baggage at the door and they say, let's work together and get things done. And it's not universal. It's not perfect, but that's largely the consensus. And I think we really, we go after that at our own risk in terms of our prosperity. We're a small province on the edge of North America, trade-dependent economy, where if we're not working together in this competitive world that we live in right now, we're going to really struggle. And so when I see people running for public office that, call people who are gay perverts and groomers and all kinds of other horrific insults that try to drive these wedges between Indigenous and non-Indigenous communities that have worked together for generations and that we're building on that cooperation, I think that puts our prosperity at risk. And more directly, I think it threatens our economy and people's their jobs and the costs that they face. So, we take the farmers in the interior that have faced this massive temperature swing that killed all the cherries and the grapevines. If you've got a leader that doesn't believe in climate change, is he going to show up and say, I'm going to support the farmers? This is something we need to act on and deal with drought. If we've got parents that are saying, women that are saying, I can't get back to work unless I have access to affordable childcare. and we have a leader that has an ideological position about, let's say, who should and shouldn't get access to government programs, does that mean that the childcare is at risk? The budget proposals coming from the Conservatives can only result in canceling new school programs, new hospital programs. John Rustad's out in Surrey saying his solution to crowded schools is to have more kids per classroom. And so
those might be bad policies, but are they a threat to democracy?
I think the threat is twofold. One is to our prosperity, certainly, and our cohesive communities here in the province of BC. And the other is to people's pocketbooks. I think it's a very real threat if your ideology is to say people should be paying user fees, what does that mean for tolls on bridges? What does that mean for MSP and all those other charges that John Rustad signed off on when he was in cabinet?
Now, I've seen that party pull candidates from the LGBTQ community. They've pulled Indigenous candidates. They've pulled candidates from the Muslim community. I've seen endorsements from the Jewish community. So going back to what you were saying earlier in terms of alienating these groups, they seem to have a lot of support from these groups, or at least from members of those groups. So what does that say about their supporters or their candidates?
Well, we'll see. We'll get to the election. I've watched them recruit candidates who are saying some pretty hateful things about Indigenous people, about gay people in the province. And when John's asked, John Rustad, your candidate said this about the gay community. What do you say about that? He says, no comment. John Rustad, your candidate says that Canada is a death-worshipping society that celebrates the murder of unborn children. What do you say about that? Well, people are entitled to their opinion, is what he said. And so those are really fringe positions of candidates that are running handpicked by John Rustad for his party. And what are these people's positions on basic government programs and supports that people rely on? If you have this kind of ideology that vaccines are poison and climate change isn't real, what does that mean if you run a business that is being affected by climate change? What does that mean if you're looking for a path forward as a person in our province who maybe doesn't fit in one of the boxes that John Rustad feels is acceptable?
Well, I'm looking forward to you posing those questions to Mr. Rustad directly.
It's going to be a lively debate, I tell you.
Premier Eby, first of all, good luck with the new baby on the way. All the best to you and your family, and good luck on the campaign trail. And thank you so much for your time tonight.
Thanks for having me, Mo.
Folks, that's our show. Thank you to BC Premier David Eby for his time tonight. And I just want to emphasize how important and cool it is for elected officials of the highest office, like Premier Eby, to be on programs like this. You know that I strive to pick discussion topics and angles that are relevant and maybe not getting as much attention. So I want to thank you, the viewer, for watching tonight. I hope you continue to stay informed, both from my colleagues here at CHEK, but also from my peers throughout BC media. If you have any thoughts, or if there's someone that you'd like to see on the program in September or October before the next provincial election, shoot me an email, mo@thisisvancolour.com. Also follow me on X or TikTok @VanColour. We will be back next week, but for now, this is VANCOLOUR, and I'm Mo Amir telling you that in a province where you can be anything, be colorful. Peace.